Good afternoon, everyone. Welcome to our virtual class. By the way, I'm Jamalia Enero, and I'm your MAPI teacher this afternoon. Our topic this afternoon is all about prevention and control of diseases and disorders, or non-communicable diseases. But before that, this is our objectives. Objectives defines the nature of non-communicable disease, identifies the cause and effects, signs and symptoms of non-communicable diseases for a healthy life. Appreciate with the vast knowledge and understanding about the prevention and control of non-communicable disease. Prevention and control of diseases and disorders, or non-communicable disease. Disease is a condition that prevents the body or mind from working normally. Two types of diseases, communicable disease, are illness that can be transferred or passed from one person to another. They are caused by pathogens like germs, bacteria, viruses, fungi, and protozoa. Examples, colds, pneumonia, influenza or flu, malaria, and etc. Non-communicable or chronic diseases are non-infectious illnesses which may result from hereditary or lifestyle factors and not from pathogens. Common examples are heart diseases and cancer that may result from hereditary factors, improper diet, and other risk factors. Some non-communicable diseases do not usually lead to death but are uncomfortable and causes suffering. Nature of non-communicable disease. Non-communicable diseases are some of the major causes of mortality in the Philippines. Many Filipinos die every day because of heart diseases and cancer. Diabetes, arthritis, and respiratory disorders are also a major health concerns. That is why it is important for everyone to know the information about non-communicable diseases and their prevention. Non-communicable disease is a medical condition or disease which is not infectious, with long duration, relatively slow in progress, which a person is unaware of the disease unless or otherwise examined, a silent killer of people. Common non-communicable diseases. Allergy is a synonymous to hypersensitivity, which refers to an exaggerated response to an antibody-forming substance or antigen. Cause, food intake, vaccine or blood transfusion, insecting, skin contact, or through nasal by smell. Signs and symptoms, swelling of the mucous membrane, redness and itching of eyes, impaired hearing, rashes, and headaches. Asthma is a chronic condition in which breathing becomes difficult. Hypersensitivity, exaggerated response to an antibody-forming substance or antigen, not contagious. Cause, dust and molds, pollens, cold air, weather change, sinus infections, stress, and certain foods. Signs and symptoms, shortness of breath, wheezing, coughing, chest tightness. Protective factors, do not inhale paints, fumes, insecticides, and cleaning products. Avoid products sold in aerosol cans. Drink at least 6 to 8 glasses of water a day. Avoid stressful situations and do not exercise too hard. Do not smoke or avoid secondhand smoke. Take all prescribed medications with filled stomach. Do not go outside in extremely cold weather. Cardiovascular disease is a disease of the heart and blood vessels. This disease is the leading cause of mortality in the Philippines. Risk factors, smoking, diabetes, hypertension, cholesterol, age, obesity, physical inactivity. Ways of reducing risk of cardiovascular diseases. Maintain healthy blood cholesterol level and choose a heart-friendly diet. Avoid smoking and second-hand smoke. maintain a healthy blood pressure, maintain a normal body weight, participate in regular physical activities. Types of cardiovascular disease are coronary heart disease, heart attack, angina pectoris, rheumatic fever, heart rhythm, abnormalities or arrhythmia, congestive heart failure, stroke. Signs of stroke, according to the American Heart Association or FAST, is an easy way to remember the signs of stroke. Face dropping. Does the face sag on one side or numb? Ask the person to smile and examine if the smile is uneven. Arm weakness. Ask the person to lift both arms. Can the person keep arms left up? Speech difficulty. Is the person's speech slur? Do you understand what the person is saying? Time to call. If the person shows any indication of the following signs, call for emergency and get immediate hospitalization. Remember the time when the first signs occurred. Sir, caused by abnormal cells growing without control. As these abnormal cells grow, they form in masses called tumors. Ways to treat cancer through radiation therapy, chemotherapy, and immunotherapy. Tumors can either be benign, masses of cells that are not cancerous and do not spread. Malignant, masses of cells that are cancerous. They may spread to other parts of the body by moving along the blood vessels or through the lymph system. This spreading is called metastasis. Signs and symptoms: change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or lump in breast or elsewhere, indigestions or difficulty in swallowing, obvious change in wart or mole, nagging cough or hoarseness, unexplained weight loss, persistent hoarseness. How can you reduce the risk of cancers? Identify the signs and symptoms of cancers. Have regular checkups. Avoid smoking and secondhand smoke. Avoid too much sun exposure. Eat fruits and vegetables. Observe the meat you eat. Exercise and have the right weight. Be aware of family's history of cancer. Avoid drinking alcohol. Avoid being exposed to dangerous chemicals and airborne fiber. Diabetes or diabetes mellitus, a disease in which the body produces little or no insulin at all. Signs and symptoms: excessive urination or polyuria, thirst, polydipsia, hunger, polyphagia. Types of diabetes are type 1 diabetes, insulin-dependent diabetes. Signs and symptoms: increased thirst, frequent urination, contagious hunger, weight loss, blurred vision, tiredness. Protective factors: take daily injection of insulin to stay alive. Follow a special diet. Type 2 diabetes or non-insulin dependent. Signs and symptoms: not as noticeable as type 1 diabetes and may go undetected for many years. Protective factors: oral medications, program of diet, and exercise. Gestational diabetes occurs in females during pregnancies. Arthritis refers to inflammation of joints. It usually occurs during old age. Signs and symptoms: joint pains, swelling, stiffness, and inflammation. Types of arthritis are: osteoarthritis is a disease of older people. It results from the wear and tear of joints, especially those of the hands, hips, knees, and spine. Rheumatoid arthritis causes pain and swelling in many joints throughout the body. This can lead to deformity and crippling. How can we manage and treat arthritis? Perform physical exercises. Lose and keep a healthy weight. Take a medicine like aspirin and some prescription medicine that will help alleviate the pain and other symptoms. Take hot bath that can help reduce swelling and pain. Kidney or renal failure is a medical condition in which the kidneys fail to adequately filter waste product from the blood. What are some symptoms of kidney failure? Change in urination, swelling in legs, ankles, feet, face or hands, extreme skin rashes and itching, nausea and vomiting, shortness of breath, feeling cold, dizziness, and concentrations problems brought about by anemia related to kidney failure. What are the ways to diagnose kidney failure? Kidney failure can be diagnosed through urinalysis, urine measurements, blood samples, imaging kidney tissue samples. How to prevent and manage kidney failure? Avoiding or limiting intake of toxic substance will help to prevent kidney failure. A key to prevent severe kidney diseases is early detections and aggressive intervention. Diabetes and a high blood pressure are commonly associated with chronic kidney diseases. Managing them with a proper diet, exercise, and medications may help prevent kidney failure. Severe kidney failure are treated through dialysis and kidney transplant. These are usually on the late stage and can be lethal. Non-communicable diseases, MATES and fallacies. MATES and fallacies is non-communicable disease are mistaken beliefs of ideas, especially on based on unsound argument. Both are directly and indirectly affecting the health of a person. Myths and facilities about non-communicable diseases. Myths and facilities. I am too young to worry about heart disease. Facts. Lifestyle during childhood and adolescence affects the risk for cardiovascular disease in later life. Plaque may start accumulating during early stage of life and may lead to clogged arteries. Now the obesity, type 2 diabetes, and other risk factors are more common at younger age. Heart problems can also develop early. A diabetes diagnosis means you automatically need insulin. Some cases of two types diabetes needs proper diet, exercise, and oral medication in order to keep it under control unit. Insulin becomes necessity. Eating too much sugar causes diabetes. In type 2 diabetes, the body doesn't respond normally to insulin and is caused by genetic and lifestyle factors. Although excessive sugar intake can lead to weight gain and increased chance of developing the diseases. Only women get breast cancer. Men having breast tissue can also develop breast cancer. If breast cancer does not run in your family, you will not get it. 70 to 80% of women who get the breast cancer have no family history of the disease. Arthritis is just an ache and pains. Arthritis comes common with aging but may develop at any age, young or old. On country, some elderly people never develop arthritis. Living in a cold climate causes arthritis. Pain caused by arthritis is caused by bone rubbing of against bone and has nothing to do with the climate. Asthma is a physiological condition. Asthma is caused by respiratory problems and triggered by allergens. Asthma medicine is addictive. Asthma is a chronic condition, so patients need to take medication for a long term, not because of addiction. NCDs mainly affect the rich. While NCDs are on the rise worldwide, they disproportionately affect the poor and marginalized. Not all NCDs are preventable, but about 80% of them can be prevented, delayed, or averted. No cause effects solutions exist for NCDs. Cause effects techniques do exist to fight NCDs, and while new ones are being rolled out, there's still a need for investment in treating and prevention. Behavior and lifestyle choices can be changed to prevent and manage NCDs. There is a need to correct myths and fallacies about non-communicable disease to be able to treat or to avoid the disease effectively, and so as to create panic among members in the society. It is very important also to educate the people to reverse whatever myths and fallacies they have in their minds. It will be good if they listen to health professionals about what really these non-communicable disease are. Okay, any clarification, suggestions about our topic this afternoon? So if none, thank you so much for listening, and don't forget to subscribe our YouTube channel at GAITF.com, and don't forget to open your LCMS. Thank you.